So I'd like to introduce our speakers for today. I'm going to get them to introduce themselves in terms of their background and what brings them to be experts or sharing their lessons with you today. So the webinar is on recruitment, retention and staff wellbeing and how support for families can help, and sharing the Chelsea and Westminster experience, which is where Sam comes from. So I'm going to hand over to Paul first and then he'll bring Sam in, and then we'll open it up for Q&A. Please use the chat as we go for any comments or reflections. So over to you, Paul.
Thanks ever so much, Nikki, and thanks to everybody for coming along today to listen and hopefully to learn a bit and certainly to engage with both myself, Sam, around the topic today. Just by way of quick introduction, I'll do a quick introduction to myself and my firm, and then I'll hand over to Sam, and then we'll get into some of the content. So my name's Paul Courtley. I work in the client team at Bright Horizons. And for those of you who haven't come across us before, we are a firm that's engaged in delivering high quality care and education. What that means in practice, we operate, I should say, a number of children's nurseries, about 1,000 internationally, 300 here in the UK. What makes us a little bit different is that you guys will all be familiar with nurseries in the community or in community settings. We work directly with employers, okay, to provide services in partnership, the aim of which is to ease any tensions for staff members, employees around managing work and family. The quid pro quo for the employer is, people that are better supportive or better supported, I should say, are well, and it is easier for employers to attract and retain and engage staff members who know that their work and family life is going to be well supported. Yeah. Okay. So that's me, and that's Bright Horizons. Sam, can I ask you to just come on and perhaps introduce yourself? And I'm sure everyone knows who Chel West is, but if you wouldn't mind jumping on.
Hi everyone, good morning. I'm Sam Slater. I'm the Head of Inclusion, Wellbeing and Engagement for Chelsea and Westminster Foundation Trust. We've got two main hospitals, one based in West Middlesex, our main hospital there, and our other hospital is based in Chelsea. We also have our satellite clinics, run our sexual health and our HIV services. And we also have an admin, people in OD area as well, where we have learning development as well. So we've got three main sites plus our satellite clinics. And we've been working with Bright Horizons since October 2020. And I've been with Chel West for 11 months. And before that, I was with a specialist provider for 12 years. And yeah, I think that's probably all I'll say for now, and then I'll let Paul get straight in.
Wonderful. Thank you. Thank you very much, Sam. Let me just bring up the deck here that we have. See if I can get this right. There we go. So I'm hoping everybody can see that first slide. What we're going to cover, or what we're going to do for this session, is reflect a little bit on the challenges, the workforce challenges that are faced by folk like yourself that are extremely well known. But I couldn't think of a way of really introducing the solution without revisiting a little bit some of the challenges. And I thought what might be helpful is if we talked about some of the trending challenges, then talked about, in terms of workforce recruitment, retention and well-being, talked a little bit on what we saw in the staff survey results that came out earlier in the year, and then also introduced some of Bright Horizons' own research, which I think will just reinforce some of the things that you guys already know, but also introduce a couple of more things that might be interesting in terms of workforce issues that we're hearing from our wider population, the people we work with. And then we'll get into what frankly will be the most interesting part, I'm hoping, for this session, which is just to hear from Sam around how Chel West have innovated, frankly, in terms of what they've done to introduce new services that are improving their proposition around recruitment, retention, and staff wellbeing. So I hope that's all clear and interesting. As per Nikki's introduction, if there are any questions or you want me to stop and answer any questions, please don't hesitate to jump in at any time. I'll probably talk for, I'm hoping, no more than sort of 5 or 10 minutes around some of the issues before handing over to Sam. We will have some time for questions at the end, but equally, I'm keen to hear from people right the way through. So I hope that all makes sense. So moving to the challenges, which again, I think you guys are probably well aware of, but they do bear repeating. So we know that the workforce, the NHS workforce, is growing, okay? And we know that it has been growing, certainly over the last sort of 10, 12, 15 years. We also know that it's not growing quick enough to meet the needs, the UK health force, healthcare, I should say, needs, and that is going to be an ongoing problem. And alongside that, and again, not lost on anybody here, we have a problem in the health service around retaining staff. We know that we've lost certainly tens of thousands of staff over the last 3 to 4 years and continue to do so. And in terms of, you know, what impact that has, you know, certainly in terms of patient care, in terms of continuity in care, yes, it's big, but there's also a big financial issue. We know from research that it costs anything between £15,000 and £30,000 to recruit in both direct and indirect costs, I should say, to replace staff members, and that is an ongoing problem. Okay. So again, in terms of the impact, there are a lot of staff vacancies. Again, not lost on anybody here. There are other issues in terms of gender pay. So we still have a gender pay gap within the service, within the NHS generally, and we still don't have parity in terms of the representation of women in senior leadership roles. And there's been some interesting kind of trending data around why people are leaving the services, and a big reason for which has been work-life balance, okay, and trying to manage both professional responsibilities and working responsibilities. And that in turn is creating stress amongst the population, amongst your staffing population. So having set up a slightly doom and gloom start, okay, there is some good news, okay. We know that this information and these trends have been recognized and reflected on. So in the NHS long-term plan, we know there are some targets around reducing staff turnover. And there are also commitments within, certainly for NHS England, the NHS People Promise and the People Plan, to make the NHS a better employer, to improve staff engagement, and to address staff well-being and work-life balance in perhaps a more purposeful fashion than perhaps we've been able to do before. I'm just going to take a very, very quick pause and invite Sam in to comment. Is that all, probably all a little bit obvious, Sam, but all fair and reasonable in terms of some of the challenges and the trends that you guys are experiencing on the ground?
Yeah, most definitely. I think we've been really across all NHS trusts, not just at Chel West, impacted by COVID-19 and the impact that's had on staff. And then you're having staff having to isolate or care for family members. It leaves you quite short on the shop floor. And similarly, more recently with monkeypox. So it always seems we're in a state of recovery, or is in a state of pressure, or is a state of making sure we are getting back to recovery, because all of us NHS trusts also have operation lists that are quite behind that we need support with. So there's a lot of pressure in the system. And I think a lot of staff have felt that we tend to lose about 500 staff a year. On our last data snapshot up until 31st March 2022, we've got 6,633 staff, substantive staff in post. So these would be all the staff that would be able to utilise the offer we have with Bright Horizons. And you can imagine, out of all those staff, how many people have been impacted by COVID-19 and also by the current monkeypox issue. And I'm using monkeypox for now. I know nationally we might be changing the name shortly, but at the moment we are still using monkeypox until we have regional or national change.
Understood. Thank you. So thanks, Sam. So it was just helpful to quickly check in on that point. So moving on, so we understand some of these wider trends, and also thank you, Sam, for picking up. We know that COVID clearly has had a very big impact on some of these statistics, and we've certainly seen that, and I think can probably draw a fairly straight line between the experience that staff have had in dealing with COVID and in some of the staff survey results. So what we've seen, I think, in terms of the survey results has been a continuation on some of those trends. So some of the things that we picked up on were that when we think about staff talking about them being safe and healthy, I was quite encouraged to see that 57% of staff is not, it's not a completed piece of work, but said that their organisation takes positive action on health and well-being, and that number was certainly higher among some of the community trusts as opposed to some of the acute settings, which I thought was encouraging. I think that encouragement was slightly tempered by the fact that over 50% of staff have felt unwell as a result of work-related stress in the last 12 months. And these are the results that came back in March this year. And equally, this number, and I think we can probably attribute some of this to COVID, has increased for 4 consecutive years. So it's troubling. Again, conversely, perhaps going back to some of the more positive news, we see that a lot of staff members, close to 50%, say that their organisation is committed to helping them balance their work and home life. And I think that's a big positive development. Again, flip-flopping to something that's perhaps a little bit more troubling, we saw around the staff engagement advocacy piece, the number of staff members that are prepared to recommend their organisation as a great place to work or as an organisation they'd like to work is dropping. And again, that's worrying. And allied to that, we're seeing an increase in, it's an increase in the number of people who are saying that there's enough staff in their organisation for them to do their job properly. So my kind of takeaway from that was that the recruitment and retention pressures are writ large in some of those statistics. So I think we're seeing some positive developments, but a continuation of some of the trending challenges. Now, one more piece before I let Sam.
Paul, are you sharing your slides? Or
Do you know what? I thought I had, but can you
just on the slide 1? You've not moved any slides on. I just wanted to check that we haven't missed anything, that's all.
Thank you. Let me just
Sorry
do
to
it
interrupt.
quick. No, not at all. Thank you. So, yes, I thought I was. You haven't missed a great deal other than my flipping through some slides, but thank you very much for the prompt. So, in terms of Bright Horizons' own research, so we survey, we have thousands of employers that we work with to help both the employer and the employee better manage work and family. And there are a number of things that come out of that research, which I'm hoping is helpful as some more things to think about for yourselves. So the first insight is around the rising generation. So workers coming into the workplace and certainly probably thinking about starting a family. And when asked to reflect on the last 12 months, nearly 6 in 10 of respondents to our survey stated that family has become a higher priority, even higher priority than it has been before. It's a 10% percentage point rise, and continues a trend that we're seeing. And I think this is consistent, and you guys might be hearing the same thing, with people saying that COVID has forced them to rethink some of their priorities, okay? And that has impact for the way that you interact with your workforce, and with the way that you think about both attracting and retaining people within your organizations. So that was one point which we felt was worth noting. The second point is that, and I think it's kind of linked to the first point, is that some of the older workers, and certainly some of your workers that are aged over 35, are reflecting on their relationship with the workplace, and reflecting on their overall direction and sense of purpose. So again, I think this has impacts, and I think this has I think this is something that you all will need to think about. I suspect you already are, but something that is going to become more prevalent for your older workers. We sometimes think this is you guys will have heard it's called the Great Resignation or Great Reset in real time. So, to put some numbers on this, 54% in the 35 to 54 age group and 63% in the 55 plus age group are reflecting on their whole life direction, okay? I think to a certain extent, NHS and healthcare providers may be slightly insulated to this piece, in that, where can there be a greater sense of purpose found than in working in healthcare? But I think it bears consideration, and something that we wanted to share with you. The third piece, or the third key insight, was that some of the things that we are doing, and some of the things that we're doing, not just with healthcare providers, but with others, are working. Okay, so that we know that by providing support for working families, it will enhance and support greater talent retention and progression. And there are some numbers here up on the screen that we think are telling. So, Sam will talk a little bit about what we do for Chelsea West. One of the things we do is a backup care employee benefit, where staff can access alternative forms of care when they have a breakdown. And we know that 79% of employers, or employees, I should say, that have that service and have access to the service are more committed to their employer. We know that where they have direct childcare support, so I'm looking at the 89% stat here, that direct childcare support in the form of a workplace nursery, or a nursery close to the nursery site, where affordability can be supported, makes it easier to return to work. So supporting some of those pieces around keeping women in the workplace, getting them through dealing with gender pay and getting better representation. And we know that, so I'm looking at the 81% stat here, we know that 81% of the client employees that we work with say that their manager cares about work-life balance, compared to 62% of the population generally. So the piece I would want you to take from that is if you are considering supporting your employee population, your staff teams, with help with regards to work and family, there's ample evidence that it works and it will have impact. One more piece before or two more quick pieces before I hand over to Sam, because I think I'm cutting into her time. Sorry, Sam. One last bit is that, so back to the backup care piece that we deliver in partnership with Chelsea West. It's enormously valued. Okay, second most valued employer support after flexible working, which we know is difficult to deliver within NHS settings, particularly in patient-facing roles. And we find that providing the support enables employees to bring their whole selves to work, okay, and to be productive and engaged. So one last piece, and then we will hear from Sam, and then hopefully get into a discussion. I'm hoping this is helpful for you. So are we on the right track? So my sense of this is, in terms of the people plan, in terms of the 4 pillars, in terms of long-term plan on what the NHS is saying around its workforce, my sense is that it is right, and the aim to look after people, to create belonging, to innovate around new ways of working and delivering care, and being as an attractive an employer as possible for anybody who wants to work in the healthcare profession is the right way forward. I suspect that there are some practical steps that go along with that, one of which is, Sam's going to outline today, is perhaps what's needed to underpin some of these aims going forward. So thank you for, I'm hoping that was useful, helpful in terms of a little bit of background in terms of setting up the challenge and some additional research. I'm going to hand over to Sam, which I know everybody's been waiting patiently to hear from rather than me. So Sam, I'll control the slides and we'll take it from there if that's okay.
You're far too kind, Paul. I'm sure equally it's double act. Let's say it's a double act. I think for us, we probably started to notice issues not just within our trust but nationally within the massive change to childcare vouchers, and that's really stopped the kind of talent wanting to shift somewhere else. They're feeling really restrained. If you think about, if we look at just childcare alone, the price of childcare is usually the same as someone's mortgage or rent payment. Sometimes it's higher depending on the number of children that they may have. And that's a massive impact. So for a staff member to then say, well, if I leave this trust, I'm now going to lose my childcare vouchers, or I'll have my total that's in there, but then I won't be able to draw down any more money from my new trust. That's a massive impact. And we found that from some thematic analysis that's what staff were saying was the main reason not to leave. It was basically, I can't afford to leave. Although I really think that this might be a great opportunity. It's a different NHS trust. I might grow, learn, shift. I'm unable to because of the cost of childcare, and I can't really afford to lose the childcare vouchers. Although we have the government system and the government portal, a lot of staff have fed back they found it more difficult to navigate, and that's also been a bit of an issue going in and then having to reset their allowance, reset vouchers and so on, reset their hours has been a bit more complicated. Whereas being able to pull down and have that autonomy yourself of saying, well, I'm going to have this amount salary sacrifice, this amount going to childcare vouchers, and having to lose that has been a real barrier and a real challenge for some staff, saying, I just can't do it. With the cost of childcare, I really feel I'm able to move. So you haven't seen sometimes people taking the opportunities they want when it comes to, yes, I could actually go into that trust for that role. When's the right time? And it tends to be that in the 0 to 5, we tend to see people not wanting to shift, more especially in 0 to 3. So if they're coming back from maternity or paternity leave, they then decided to stay in the trust that they're in, even though they know that it's not working as well. And then we've also seen a slight shift in staff 50 plus, and that's taking on more of that parental role for their grandchildren, or an auntie and uncle role, taking on some of that role for the 0 to 5, or sometimes even for primary school age as well. So that real shift in saying, well, actually, I need to change my shift patterns. I need some additional support because I'm now doing school drop off or school pickup, or I need to, the childminder finishes at 6 and now we need to look at this plan. So it's really that shift. I think we're moving more into needing that support. I think more people are going back to work earlier in the NHS, although we have some really good policies around maternity, paternity and adoption leave. It is still necessary that people still want to work and have an income, and you can't be in 2 places at once. And for us, we were thinking, well, what could be available? What is a possibility? And before I started in the trust, the pilot had already began with Bright Horizons, with backup care. And it was saying, well, actually, what can we offer here? What can we do for staff that's really going to make a difference, that might have an impact on some of these challenges? And it was to introduce backup care. So backup care was first offered to all staff 10 days under 2 kind of remits. One would be for any children you have. And say, for example, your care fell through. So you've got a regular nursery or a regular childminder, regular care provider, registered provider, and that was to fall through. Having backup care would then allow you to take that option use one of your days so that then you can go into work. And we found that a massive stat is 86% of our staff at Chell West has said if it wasn't for backup care, they wouldn't have been able to come into work. So you can imagine the strain on services that are already fragmented. And this would mean cancelling theatre lists. This would mean reduction in outpatient appointments, even for staff who are working in more corporate areas. Again, the impact that has, because I think people don't always see the glue that holds the organisation together. And in our learning development departments, organisational development, human resources, employee relations, again, backup care is needed there. You know, we've got so many pressures, not just for clinical staff, and to have backup care relieving that pressure has really made a difference. To imagine the cost of having to cancel a theatre list, or the cost of having to cancel many, you know, employee relations appointments or recruitments and panels or anything like that, due to the impact of not having staff available. So it's been a real game changer at Chell West. We've really been able to look at the pilot and reframe it, review it. Initially, we're focused on that first offer of the childcare and providing that support, and found that we're offering out to everyone, even bank staff. But actually, we weren't doing it justice. So we reframed in the contract. Now we're offering it to only substantive contracted staff as an additional thank you. So it's part of our rewards and recognition. It's part of that retention piece to keep staff with us at Chell West. Because it's great that we've got bank staff and we really want to support our bank staff, but actually we wanted to pull this back and make sure it is an offer for our substantive staff only now, which is what we changed in our contract. So it's kind of thank you for choosing us. Thank you for having us as your employer. And similarly, the other approach we have is the backup care is also supported for any adults you might be caring for. Now, we all know when it comes to caring responsibilities, it's more likely that in adulthood, we will be caring for one of our loved ones. We will be caring for a parent, an auntie, an uncle, a significant other, maybe your partner. And it's really important that although that has a massive impact, and lots of people don't like to be called carer, but it's how we're going to identify you, it's really important that we are doing something about that too. So for us, we've been utilising and seeing an increase in that provision for adult care. So for example, if respite care was to break down for that day, if your, again, named carer was not able to come in, we've still got the backup care available, again, 10 days per year for that staff member to use. And that's been instrumental. We've had, you know, I can talk about some of the experiences that staff have had, because we ask staff who have used the service to share their experience. So we build up our testimonials, and we use this for lots of our health and wellbeing reporting information, and as well as our EDI work as well. And it's really important to hear from our staff. There's a quote here from our DEP director, just looking at, you know, what can happen again. But I want to actually talk about some of this in adult care, because we forget that some of our staff will be needing someone to provide that support to an adult that they're caring for. And one of our doctors recently needed that support for a parent who has dementia and was really struggling and thinking, what do I do? I'm not sure what I should do. I feel kind of, it's up to me, it's my parent, I should be there looking after my father. But actually, there are options out there. We can use backup care. So once he was aware of being able to use backup care, that was a great option for him. And he was so grateful and so thankful that he knew that his father would be cared for whilst he's in theatre performing operations. And that was a massive, massive, huge relief for him. Similarly, we've had nurses doing long days and then worried about the night shift. And for one of our nurses, just knowing that someone was there to read them a bedtime story, tuck them into bed, and then get there just to finish that piece off was just alleviate that guilt for her. She felt immense guilt of sometimes those long day pressures at work. Really, you know, when you're on a 7 till 7, you're then getting home at 8, your child's already, and it's already bedtime for your child. And just feeling like I can't be in two places at one time. I really want to make sure that after childcare, there is that support there for my child, but I'm on a long day. So we have seen that supported staff in having a bit more of that work-life balance. And I think it's really important that staff do feel that is a lot of guilt. You have a lot of guilt when you're caring, whether it be for children, whether it be for an adult. It's really important that as an employer, we're doing something to try and alleviate that. So even in my team, we'll have these conversations. We do lots of work. Recently, over the winter pressures, we haven't been able to have Bright Horizons and the backup care team in, because what we usually do is have big event days across both of our hospital sites. And then when me and my team are out in our satellite clinics as well, we'll have conversations there, make sure people are aware of our Bright Horizons backup care offer. And we've seen such an impact. So when we first looked at this in the pilot to then having the contract, then moving, we have seen it increase so much. It has been so much bigger than we could ever imagined. And there's been so much uptake. So I think at first in the pilot, before I started with the trust, it was a case of, will this work? Will it fit right? What's going to happen? And there was some of those questions like, have we booked too many spaces in this pilot? And it was the complete opposite. And pleased to say within our contract, it's just increased. By each quarter, we're seeing probably about a 25% increase in need. And that's phenomenal to think that people are really appreciating this offer. I think the challenge is, now that we're reducing some of our infection control measures, we will be able to have backup care back on site. So we do have some dates booked in for next month, which is fantastic. And I think we do miss having our partners there on site. I think it's really important when we do have backup care there with us, talking about the importance of this, getting that message out to staff and having some of those detailed conversations. It's really important because some staff may have seen a big communications that comes out from us in our trust. They might have heard it mentioned in an all staff webinar. They might see it mentioned in a bulletin. The information is there, but it's very different to having that one-to-one and having a conversation. So it's really great when Paul or someone else from the team comes on site and they're able there to have those conversations with me and my team out there with our staff to say, what's stopping you? What's stopping you from activating an account and utilizing backup care? And some of it is that, well, someone else might be more needy and someone else might need this more, but actually this is here for you. And it's really important that you utilize it. We really want you to be able to use this and not have those pressures and to alleviate some of those pressures. We want our talent and our staff to stay with us at Shell West. This is why we continue to offer this, because we know that staff are leaving and do leave, and when it looks at staff leavers information, because of that work-life balance, we do have, like most trusts, issues around that retention piece, around flexible working. And this is one of our flexible offers, is that yes, you might have work constraints, you might have some difficulties, but actually utilize your backup care. And what we found quite surprising is, going into this that we didn't know about, which has been a really great benefit, is that lots of staff have been able to use providers they'd already utilize. So some of the summer camps that they might have to use for childcare, they're able to still use that. So it's like, let's check out with the team. Is your current provider registered? It's not registered. Okay, let's talk about how we can register them, what information they might need to register a provider. And that is a massive alleviation again for the staff member, that they're actually being able to use a provider that they wouldn't usually use, but they're having it to use it over the summer periods. So you can imagine summer camps, cost of that during summer, or cost of respite care for an adult, and then just having those days over with the provider you usually use is such a great benefit. It takes away a lot of that stress and a lot of that pressure. And so for us, it's been fantastic. We recently were HSJ finalists with our backup care offer. We didn't win, but it's the taking part that counts. And for us, it's just the experiential difference it makes to our staff. For us, it's nice to win an award, but for us, it's just knowing that our staff have that peace of mind. They're utilizing something that really works for them, that takes that pressure off. So for us, it really is about staff experience. And we have seen a slight shift in even our staff survey results from that. And it said, but to me, it's the testimonials that mean the most. And we've got some lovely videos that we send out to our staff, just of staff that have used the program and again, what it's meant to them. And 2 of those I've shared with you today. As you can see, we've got an example there that Karen has put up. And I'm going to leave it there for now, because I think it's really important you will get to ask lots of questions. If there is anything you want to ask, or if there's something you want to ask and you don't feel you can ask it here, please go through Nikki to get Paul or mine's private email so that you can email us as well. And I'll leave it there and open up to questions. So thank you very much.
Thanks, Sam, and thanks, Paul. We've got a few questions in the chat, so I'll go to them in order if that's okay. So We've got one from Laura G. Asking really, this is what I thought when I read the quote from your deputy Karen. How many children feel comfortable going to a nursery that have never been to before? How do you overcome that? I don't know who wants to answer that, whether that's Paul or Sam.
I'll give that one a go, and Sam may follow up. I mean, it's the question that any parent, right? And we get it from everybody. And the truth is, it's a concern from anybody with regards to going into an unfamiliar environment or having an unfamiliar carer come into the home, because it can be nurseries, childminders, adult care providers, and it is difficult. So we train the network that we use at Bright Horizons is all directly contracted. Obviously, it has our own nurseries in it, but it has 7,000 care providers across the UK. They're all contracted to us. We manage the quality assurance process, and we train them in how to deal with backup or emergency instances of care, as opposed to a regular ongoing piece. The truth is that there isn't a lot you can do, because what happens is one or two brave souls will need to use the benefit and need to use the service, and they will use it, and they will have a fantastic experience. Okay. And it is also true that it is invariably the mum and dad or the carer that are really feeling anxious, and children, in this instance, are actually incredibly resilient and will generally, within 5 minutes, get on with things. But to answer your question a bit more directly, some people will use it. They'll have a fantastic experience. They can still use their regular care arrangements if they need to, and if they're on our network, which they can nominate to our network. And then the word of mouth grows around, and people say, did you know you had this service? It was brilliant for me. I was worried about it. I was worried about using an unfamiliar carer, but it was actually a brilliant day. The child was super happy. We get lots and lots of very emotive feedback saying how wonderful it's been. And that's the only way you can get past it. So a few brave souls started off, start telling everyone else they've had a brilliant experience, and then you see the uptake grow. Does that answer the question, Nikki? Have I answered it kind of?
Yeah. Sam, is there anything you want to add?
Yeah, I'd say likewise, it is that word of mouth, and the word of mouth spread from the experience. So like anything, when it's your child, when it's an adult you're caring for, you're going to feel that vulnerability, and a lot of us may feel it's our responsibility to do that. So I think a lot of that might also come from us, and then having your child in an environment where they're not familiar, there are those worries, but we've had such great feedback from staff. And I'd say, again, more the worries in our trust was around the adult care. And it was more that obligation, I need to look after this adult. I am their carer. So I felt we kind of got a bit more of that challenge more from that. But staff that again have utilised adult care through backup care have been really, really pleased. And again, it's taking off a lot of that stress. So I think it's like anything, it can be unnerving, going somewhere for the first time for a child, and also for an adult having someone coming into their home and to provide that care for them. But again, it's how staff have then felt after. So I think it's those initial feelings, but the experiences after have outweighed those initial concerns.
Okay, that's great. Thanks, Sam. I'm going to move to Helen's first question, just because I think it follows on from that in terms of assurance. So she's written, I assume that the Bright Horizons team have regular assurance re any local emergency providers in terms of DBS regulation, etc., and that is updated. So Helen's seeking some assurance around checks that you do to make sure providers are legit, if that's the right word.
Yeah, it is. And so we have as you might imagine, we have a quality assurance process, policy and pieces, which is extremely stringent. We're helped here in the UK in that the regulatory environment is extremely stringent as well. So providing provider is registered and regulated, typically by Ofsted for the early years, and for care quality for adult care, then that helps us. But we do our own checks as well. So we are, we're a care provider, a high quality care provider, and that helps us understand what good care looks like. So we incorporate that into our own policies and procedures. We have a provider relations team whose job it is to, when a provider, the provider network, the carers in our network are all invitation only. So, you don't generally apply. The network grows when we add new customers and clients, and they say you need to be here, here, and here, and they will also nominate providers to our network. And providing they meet our quality assurance piece, that's how we grow our network. Okay, and a measure of the coverage is that we fulfill 97, 98% of the over 100,000 requests for care that we get on an annual basis. But again, information that we're happily, readily willing to share for those who might be interested in talking about it a little bit more.
Thanks, Paul. So I'm going to move back to Lisa's question. I think it's probably to you, Sam, initially. So is this purely optional with no pressure on staff to use it? And she too wonders about the experiences of children, depending on personality, resilience, etc. So do you force staff to use it, I suppose, is the question. My words,
not at all.
Lisa's.
Not at all. Yeah. So in response to Lisa's question, it's purely optional, and it's there to take the pressure off it. We have this as a health and wellbeing benefit for our staff, for all of our substantive staff, but there's no pressure to use it. And lots of other people may be juggling and using other things, so there's no need for them to use it. There's no impact there. We don't regulate it in any way where it would impact on a staff record or anything like that. It's purely there as that support. And I think the only one concern we've had is when staff members have maybe opted in too late, and then they've wanted to have the care provided, but they haven't registered and activated their account quick enough. Because once their account is registered and activated, they've then got access to book the care. So I think that has been the only kind of negative feedback we've had, where a staff member wasn't aware, wanted to just be able to use it, but hadn't activated account. So I think that was it, but there's definitely no pressure from us. This is just a pure benefit. And again, I think it's like anything, all children or adults, we're all so different. So it's always that worry of not knowing, depending on someone's personality and their resilience. But lots of children have got really good coping strategies of being in a different environment, making new friends. I think, again, as I expressed earlier with the question prior to this, it is more around the adults, and if someone has got a brainstem disorder, Korsakoff syndrome, dementia, the capacity might be an issue for the adult you're caring for. So I think that's the biggest concern we've had. If the adult you're caring for doesn't have capacity, then there's more concerns, because they can't really check in on how was their day, how did it have been, and everything else. So I think it's more with an organic illness, staff have tended to be more worried for the adult they're caring for.
That's great, thank you, Sam. So move to Helen's second question, which was, how does this work for community staff? Is there a borough countrywide cover? So obviously staff that work in community, they're out everywhere. So how does it work for them? So I don't know, Paul, if you want to answer, and then
I can do. And Sam maybe can talk about, because the Chow West team are spread over a reasonable size geographic area. So the aim is so our network needs to respond to the needs of the people that use it. So we don't just constantly bring on new carers and thousands of nurseries and the rest of it, because it's not really what we want to do. We want to be able to manage it, and we want to be able to quality assure it effectively. But very often when we do add a new client, for want of a better description, we will take on some home postcodes, and we've certainly done that with a couple of NHS trusts, taking on just the first 3 digits or 4s if we're not picking up any personally identifiable information, and then we'll map it against our own care network, and then we'll show it, and then we'll share it. And if we need to add carers to the network, then we'll do that through an implementation process where people can nominate their own carers, or we will identify that we need more coverage in a particular area. But at the moment, the network it's UK wide. But we would always look at any new client and customer. And one of the pieces of diligence that we do is share with us where your people are, so we can make sure that the network will respond to any demand, because our measure is 98-ish% of care requests we have to fulfill. And we say to Sam, we're going to do those numbers so that they're not hearing, yeah, this is great, but I've tried to use it and I can't get I can't get care. So I hope that helps. That's how we build things up.
Mhm.
Just to give an example of community, the one that springs to my mind would be our community midwives. And then they will be out, they will be about. Again, as I've mentioned, we are across 2 big hospital sites, plus all the satellite clinics. So it is a vast area. It's not all in the same London borough. It's spread across 3-4 boroughs. So therefore, again, it's good coverage. And we tend to find that a lot of staff will actually prefer to have the backup care nearer to their home. So as you can imagine, Chelsea and Westminster isn't the cheapest of areas to live. So we've got lots of staff that travel in from the surrounding counties. We have people coming in from Surrey, Kent, Bedfordshire, Hertfordshire. They're coming in around to come in for travel, and their care is breaking down at home. So we will find that most providers, where backup care is national and Bright Horizons is a national organisation, they pick the backup care nearer to home, so that then they're not having that pressure of then coming somewhere to work, then dropping off the child or the adult or so on. And again, for the adult, it would tend to be the carers coming into your home or into the house that they need to care for the person. So it tends to be more localized to where the person's living.
Okay, thanks, Sam. So this was my question. The people have put in an element of discussion around the cost. So it'd be really helpful, Sam, if you just explain how it works and whether the assumption around the cost is offset by reduction in recruitment. So I suppose that my question was about business case. You know, how do you develop the business case? What's the investment required, etc.
That was exactly it. It was the business case. It's saying, if you look at most NHS trusts, even before the staff survey was realigned to the People's Promise, you would see probably last several years, there's lots of information, data there to tell us that work-life balance is an issue, retention is an issue. When you look at our joiners and leavers survey data for lots of us across the NHS, you'll see lots of evidence in there. You'll see again your top 3, your top 10, top 5 reasons for people leaving the organisation. And it's really important that we use that as part of our evidence, part of our business case, showing the areas in our staff survey where we need to do more work, where we've got the biggest challenges across our organisation. And similarly, what can we do about it? Why are people leaving? Why are we not retaining some of our talent? Why have they then, jumped across to another NHS trust within our integrated care system, or why have they moved further afield? What does that mean? Why is this happening? So for us, it's trying to understand the narrative behind the intelligence. And once we did, it was then putting in exactly a business case. So we put in a business case for health and wellbeing, a 3-year business case, so that then we could say we want to offer these programs to really support staff and support staff experience, and to ensure that staff aren't having always that differential experience that we know they're having. And it's really important for us to say, what can we do? What can we change? What could be the difference? And for us, backup care met a lot of those needs. It was one thing we wanted to introduce that we budgeted for within our 3-year health and wellbeing case. And you can see the difference, because if you think, yes, you might say, well, actually backup care seems quite expensive. It seems like that's quite a big price. But you're looking at probably about 1.2 million savings per year by not having to cancel theatre lists, by not having that reduction, by being able to provide quality and safe care. Now think of quality and safety as our main area of concern, and it's about providing that safe care to our patients and making sure our staff feel safe in delivering that care. And when you don't have the right amount of numbers or the right people with expertise in those areas, we've got a difference there in that delivery of patient care, and also the safety and that feeling safe of our staff. So backup care has been able to really help us support that by enabling our staff to be on site and have the right experts in the right areas at the right time. And we have also seen a difference on health roster. So you may have seen last minute leaves for emergency leave, be that parental, be that other types of emergency leave, also sickness absence, a person getting so stressed and anxious about the care they need to provide that it's become a sickness day or a sickness period, or that kind of elastic band phenomena where you keep going and you can only take so much, and before you know it, you've got then the staff member who's off for a couple of weeks due to the kind of caring responsibilities, whether that be again for a partner, for an adult, or for children. So I think it's been really, we've been able to see that shift, and we've had that reduction in sickness absence and that reduction in emergency leave.
Can I just follow up a question that's in my mind, Sam, around how do you project the need in terms of how many places you're going to offer in terms of, you know, elderly care, childcare? How did you go about projecting the demand, potential demand?
Yeah, so it was literally looking at, again, from surveys and from Intel and from the work that Bright Horizons done, coming together with the information we had, it was saying, we think this might be the right figure. Let's try that in the pilot, see if that works, based on the intelligence we have, based on the increase in population health data that you can see, looking at demography data as well, and allowing that to be included, and where staff are. So we also do a kind of map of locality of where staff would be, how many staff we do have that are living within the boroughs we serve, and how many staff are outside of that. And then looking at age data, and then drilling that down, looking at kind of birth data. Then we know that if we are between 50 and 55 plus, it's more likely we're going to have caring responsibilities. Some people have caring responsibilities from childhood, but the likelihood is that there's critical events that will happen to most of us once we're in our 50s, and it's those impact of those critical life events that mean we might need to change and rejuggle things and have that shift. So we use a lot of that intelligence really, and then that gave us our baseline to think this is probably the right figure we're going to start with. And then we're quite shocked really to see that figure, once you know, word by mouth has spread, staff were aware of what was available, it did increase, which was another reason to then offer it to substantive staff. So yes, there was that benefit to bank staff, but actually it's incurring more of a cost to us as an organisation if we're offering it to bank staff. And it's about, actually, if we're offering it to bank as well, we want to actually really keep this for our substantive staff. So then it is more about that recoup. And I think B. Tomlins had also put that in there. It's around that retention, it's around that recoup. And I think it's important that there is that benefit. So although it might seem like a big outlay to spend for backup care, what you could be saving per year is, I'd say, probably around the £1 million mark, if not more, which is not what it costs.
Thank you. I won't ask what it costs. But anyway, we've reached, it's nearly 12 o'clock, which has gone really, really quick. So thank you to everyone who's taken part. The slides will be available on our hub. We'll put them on as soon as we have the opportunity. And we will be sending an evaluation out. So really, really encourage you to fill that in. If you fill it in, we will send the research from Bright Horizons that Paul has shared today. So again, thanks for being here, and a thank you to Paul and Sam for your time. Have a good rest of the day. We'll see you again soon. Thanks for now. Bye.
Thanks, everybody. Appreciate it.
Thank you for your time. Thank you.